Good morning, everybody. My name is Jim Maney, and I'm the Executive Director for the New York Council on Problem Gambling. Thank you for waiting. To me, this is like a rock show or a Broadway play that people do not want to miss this opening act. And so that's why we waited for everybody to roll in. And I will share, being involved in the field for a very long time, every year, our partners, the state of New York, OASAS, and the Gaming Commission do more and more to raise the awareness of problem gambling in the state of New York. And they do more and more to advocate for services for the residents of New York. It's been wonderful to see the change in the growth, in the commitment from our state agency partners on doing these things. It's a wonderful thing to see. I look forward to hearing what they have to say today, Pat and Rob. It is very much my honor to introduce them as folks I've known for a long, long time and whose hearts are committed in the right direction and care about the residents of New York at all times. So I'm very pleased to introduce them this morning, and I will start with Pat Zuber-Wilson. I have to put my glasses on though, who I've known for a long time. Pat Zuber-Wilson. In April 2019, Pat Zuber-Wilson was appointed Associate Commissioner for the Division of Prevention and Problem Gambling Services. In this position, she oversees the continuum of substance use disorder, SUD, and problem gambling prevention services. I'm going to interrupt for a second. It's quite the title, and it's quite the responsibility what Pat has and what she has to do for the prevention of substance abuse and gambling disorder in the state of New York. It's a huge position, so thank you, Pat. The division is responsible for policy development and funding supports for evidence-based prevention programs that reach youth, families, and communities across the state through education programs, community-based prevention and public awareness. Pat strongly supports and advocates for prevention services that are data-driven, evidence-based, while at the same time culturally responsive and community-focused to reach people across the lifespan. She joined OASAS in 2007, and prior to her recent appointment served as the Director of Government Affairs and Federal Policy. In this position, Pat led the agency's effort to monitor state and federal legislation, regulations, and policy issues. She was also responsible for working with local, state, and federal elected officials in government agencies. She worked closely with the federal recognized Native American nations in the state and other key constituency groups. Across the span of over 30 years in the public sector, Pat worked at the State University of New York Research Foundation, the New York State Department of Social Services, and the Executive Chamber under the administration of Governor Mario M. Cuomo. She also worked for the Office of the Speaker of the New York State Assembly on a range of policy issues. A lifelong resident of New York State, she is a graduate of Brown University in Providence, Rhode Island, and attended the University of Albany for graduate level courses in business management. She lives in Troy, New York, with her husband, Craig, and her rescue dog, Della. I'd like to introduce Pat Zuber-Wilson. Thank you, Pat, for being here.
Thank you so much. You know, people talk about a double dose of espresso. You get a double dose of Pat's this morning, added to Jim's energy and an excitement over our work. Jim, you motivate us. You really do. We have no other action to take. And then when we start not taking the actions the way we should, we know that Jim Maney will be there knocking on our door and reminding us of the importance of the work as it relates to problem gambling. So Jim, I thank you for your leadership. I also want to thank Steve Block, the president of your board of directors, for tireless efforts as it relates to problem gambling in New York State. And I'd also like to recognize Robert Williams, who is going to be joining us later, I believe by video, for his leadership with the New York Gaming Commission. And it's really been a tremendous partnership between our agency, the Council on Problem Gambling, and the Commission as part of the Responsible Play Partnership. So again, I thank Jim for his leadership, Steve Block, and everyone at the New York Council. I'm just curious, I'm just going to do a little roll call, and everybody has their buttons, right? I don't have my buttons some mornings, so it's okay if you don't have yours, right? You got your ups, your downs. I know we have people from all over the country, well, we do have people all over the country, but we also have people from all over New York State, Long Island in the house. Give me a thumbs up. Somebody from Long Island? Okay, New York City? Woo woo. Okay, I'm seeing some thumbs up. Mid-Hudson Capital Region, I'll make this quick. Mid-Hudson Capital Region up to the Canadian border. We'll even add in Northern New York. Central? Rochester West. Is Rochester West Buffalo, Ohio? No, yeah, okay. And I even saw that, I've seen this morning that you even have some participants from Las Vegas. And so congratulations on that, because this conference has become not only a New York State conference, but a national real source of information for everyone involved in problem gambling prevention, treatment, and recovery. And with that, I will start some of my comments. A great thing that's happened within our agency is that the two Pats have teamed up for the work around problem gambling and substance use disorder prevention, treatment, and recovery. And this has really been a great partnership because of the tremendous work that Pat's division is doing in terms of treatment and recovery. They really are leading the way in terms of treatment services. And selfishly, it also gives us some time in the Prevention Bureau to really start focusing on prevention the way we should. And so, this has been a great opportunity for us and a new opportunity for us. A couple of things that I wanted to mention before I turned this time over to Pat Lincourt. As I said, this is a time for us to focus on prevention. And one of the things that we're really going to be working on is how does problem gambling prevention fit into the strategic prevention framework for OASIS and our division. We really want to look at some of the things that we need to be doing to support the efforts of the council and support the efforts of all of you who are on this at this conference today. I think having a SPIF that is data-driven is really going to help us develop a strong logic model, and it's going to help us to really develop that path, that trail, that making sure that we are doing the right things as it relates to problem gambling prevention. It'll also give us some markers to make sure that we are in the right direction. And we look forward to, developing or including problem gambling in our SPIF. And we look forward to sharing and having a dialogue with the council on our SPIF as it relates to prevention services. Again, a major focus will remain public awareness and community capacity building to help communities understand and address problem gambling and understanding the importance of the prevention piece of this. There are new things happening in New York State, and I know that you've discussed them already in terms of mobile sports gambling and other gambling access. And we want to make sure that we are talking to everyone, especially young people, especially youth, especially young adults, everyone across the lifespan, as mentioned. So I just want to say that we're involved in some partnerships beyond the work that happens with the council, beyond the work that happens with the commission. We are in conversation and working with SUNY administration to talk about problem gambling and how problem gambling affects college students in our public university system. We are also talking and having conversations around problem gambling prevention with the state office for the aging, for we seasoned adults. So notice I didn't say senior citizens. We're seasoned adults. So we are also going to be ensuring that our prevention workforce is knowledgeable and about underage gambling prevention. And I'm looking at some other notes. We're training TOT, and we're looking at providing prevention training throughout our system for our funded and certified prevention providers around problem gambling behavior. So we want to make sure that throughout our system, we have 154 prevention programs in the state, that we want to make sure that everyone is equipped with information regarding problem gambling and prevention. Our prevention providers are required as part of their contract with us to include community outreach as part of their work plans. So we make sure that we have, that they're all doing that, but also and involved in that, but also give them the resources and the information to make sure that information is available to them. Prevention professionals are also trained in Teen Intervene and will now be able to screen for problem gambling and provide brief intervention services. And we want to make sure we are also connecting youth who need those services to our treatment system if necessary. Again, an opportunity where we have a great partnership between the two PATs and the two divisions to make sure that is a seamless transition. We're also partnering with the Responsible Play Partnership and are pleased to participate in the Gift Responsibly campaign aimed to reducing youth access to gambling activities such as lottery tickets being put under the holiday tree or at the holiday table. And it really is one of the most prevalent forms of gambling that we see. And we want to make sure that individuals are aware that providing lottery tickets may not be the most appropriate holiday gift for someone who is underage. So we will be actively working with the partnership. I just also want to mention that we completed the problem gambling prevalence survey this year. And the findings are going to be very important as we develop our SPIF, as we look at strategies across the state to improve our prevention efforts. The findings show, I think, what we all knew, that young adult male population, especially in underserved communities of color, are a population that we really need to focus on in terms of our work related to prevention. In addition, the survey revealed a larger percentage of problem gamblers that didn't believe gambling could become an addiction as compared to recreational or non-gamblers. So we think it's important, those prevention efforts. We look forward to partnering and continuing our partnership with the council and the commission, and probably here to answer any questions for you. And thank you, Jim and Michelle and the team from the council for your tremendous work as it relates to the services that many of our New Yorkers need. So with that, I guess I'm going to turn it back to Jim so he can introduce Pat Lincourt. Thank you.
Pat, thank you so much for that. It's so rewarding to hear and refreshing to hear the amount of work, not only that you're doing now, but you have in the future. You know, advocating for problem gamblers, it's so wonderful just to hear that you are so invested in the organization, so invested in it. And, it's interesting for New Yorkers to hear that. I know there's not a lot of just lay people on today's conference, but it's so important for them to hear that people have their back and that people will be there for them if need be. Because we don't know as the future goes, who's going to need our services, especially with problem gambling. So to know that we're going to do all this prevention work, wonderful. So thank you very much for that and appreciate it. Pat Lincourt. Hi, Pat. How are you? Pat Lincourt currently serves as the Associate Commissioner for Addiction Treatment and Recovery Services at the New York State Office of Addiction Support and Services. In her role, she oversees treatment and recovery services. She implemented program aspects of several Medicaid reform initiatives, including managed care carve-in, delivery system reform, incentive payment, and the value-based payment approaches to addiction care. She has worked with state agency and private entities to develop trainings, clinical support tools, and technical assistance for programs. She has worked with OASIS providers to improve care through continuous quality improvement and the development of client and program level metrics. She has supported the development and implementation of recovery centers and the integration of peers into certified outpatient settings. She has overseen several SAMHSA grant-funded programs, NIDA-funded research, and implemented innovative programs to decrease opioid overdose. She has published several articles in peer-reviewed journals on motivational interviewing, quality improvement SUD programs, and level of care determinations. She has over 30 years of clinical and administrative experience. In addition, mental health and child welfare settings. Her interests include implementation of evidence-based practices, service integration, and financing of substance abuse services to improve outcomes. She has a master's degree in social work from the State University of New York at Albany and is a licensed clinical social worker. On a personal note, I used to have an office right next door to Pat for a short period of time and was always amazed by her level of excellence in everything she did. It showed up all the time in her work with, no matter if it was staff, clients, the outside world, whatever. So I'm very pleased to introduce Pat Lincourt, who I know, just like Pat Zuber-Wilson, has her heart in the right place to help New Yorkers as it relates to problem gambling services. So thank you, Pat, for being here today.
Thank you, Jim. It's a real pleasure to have the opportunity to speak to you all. I see familiar faces here. It is always a pleasure. Pat and I are now getting seasoned at these events where we present together. And it isn't just for show, I tell you. We have both are very fortunate to have excellent teams working with us. I see Ileana here and Bridget Hartman-DeCenzo and others who do collaborate every day to make sure that we're looking at the full continuum of care. One of the messages that I've been trying to deliver when I have this opportunity is, recognizing that we've been through, a tremendously difficult year and a half together. And there are disagreements in the field. There are kind of fissures with people going different directions and wanting and looking for different things. And it's really the time for us to recognize that through all of those kind of disagreements that we have, we're sitting at the same table together. We're caring about the same people, and those differences come from the passions that we all have to make sure that people are served well. So I just have been trying to use that opportunity, and it is evidenced by Pat and I trying very hard in OASIS to bring together, whether you're a prevention professional or a licensed social worker, a CASAC, a certified peer, that we are all working toward the same goal for all New Yorkers to hopefully prevent and never need the services of treatment or recovery, but when they do, to be there and to be able to listen and to provide person-centered, person-directed care. The recovery part of this is the lived experience and the importance of a specific gambling lived experience for working with gambling people who have gambling disorders, and the recruitment. So one of the things that we hear consistently, whether we're talking about block grant investments or we're talking about some gambling investments that may come that that it's that recruiting the workforce that really has the expertise is getting harder and harder. And so just wanted to acknowledge that that is OASAS is prioritizing that as one of the places to make investments to help you to be able to do that. I did bring some slides. There's some treatment narrative out there, some myths, I think, about treatment and people not being as invested in getting treatment. And so wanting to, kind of bust a little bit of that, of the mythology and to, show people some of the actual data that we have. I have quite a few slides, and they're each a little bit different versions of the same thing. So I'm going to go through them rather quickly. And the first slide that I think that you're all seeing, a thumbs up on that you're okay, is showing the number of admissions. So these are non-unique people. There may be some people here who've had more than one admission to a WASAS, substance use disorder treatment program, that also had a positive gambling screen. We haven't typically looked at the numbers here, and I'm getting a question about slides, and yes, we can share these, that we have seen significant growth in the numbers of people who we see and provide treatment for within the OASAS system. So from 2016 to 2019, significant and consistent growth. In 2020, we obviously had a dip in admissions. That happened across our system. When you look at the data on a month-to-month basis, you can see that it was, there's two distinct periods where we saw decreases in admission from March of 2019 to March of 2020 to approximately May or June of 2020. So that first wave of COVID and the lockdown happened in there. And then another toward the end of last year when we had that second wave. And since that time, we're seeing the increases. So we're anticipating that in 2021 and in 2022, we'll see that trend back toward the growth that we had seen in terms of bringing people to treatment. The next slide. Oh, am I moving? Can I move? No. So I just want to make sure that, yeah, okay. Is the percent of admissions, and again, this is non-unique people who did have a positive gambling screen. So it's just showing the percent of growth, that it's been consistent up until 2020. Oh, these are the, I'm sorry, this is the overall numbers. So it's a little below prevalence, what we would see, in terms of the, what we would expect in a general population. But we are seeing significant amounts and growth in that as well. So next slide. So this is a number of admissions, and again, they're non-unique to OASAS gambling programs. So we saw a little decline in 2019 that we're trying to understand, and we'll work with the council to better understand this. 2020 makes sense to us because we've seen that decrease across the system. So the question I'm getting is, what is meant by non-unique? Excuse me. And so what that means is that these are not individuals, these are admissions. So there are individuals that will have more than one admission over the course of a year. So we can either count admissions or we can count what we refer to as unique individuals. These are admissions. So there's likely to be individuals that, have had more than one. So if we go to the next slide. So this is, again, admissions non-unique to our programs that have had a gambling screen or to the gambling treatment program. So this is additive. We're just showing that, when you start adding we've typically kind of bifurcated the data here and shown only people who have gone to gambling specific programs or people who come to a WASAS. And we just wanted to add this to show the reach and to give you feedback on the progress that you have made in terms of bringing people to treatment. And of course, there's a prevention aspect of that, which is why it's so important for Pat and I and our teams to work so closely together. Because as people, one of the things for gambling, and Pat points this out, often is that families may not be as aware of how to identify or to be, or individuals of the risk factors or the kinds of things to look for in terms of a developing problem or risky pattern of use. And so prevention efforts are essential. I think people have more popular images of people who have a substance use disorder or other types of addiction. Gambling sometimes can take a while for people to recognize that they're in trouble, and oftentimes that's later than we would certainly want it to be, where people really have severe financial difficulties. So wanting people to get help earlier, of course. And then the final slide. And Roxanne Wilkinson is asking, are these specific to outpatient or inpatients or both? These are outpatient numbers from our data, from the client data system, and the Gambling Resource Center's data is also included here. So this is from, we have 3 different data sources, which is one of the things that sometimes can be confusing when you're talking about gambling treatment data, because there are people go to both the WASAS certified providers that do report on a client data system. They also go to private practitioners and they report to the PGRCs. So that's one of the reasons that we wanted to start accumulating this data so we know the scope of our reach to individuals and to family members. So, a lot of different data slides. Certainly, we can make them available to people. And Jim, feel free to share with those who have, attended this conference. And I'm certainly open to questions about that data. But what I wanted to share back with you is that this is reflective of the work that you've done in New York State to do outreach to people and to provide treatment. The only other point that I wanted to make this morning is about families and about doing focusing attention, as we have been in the SUD world, on being able to provide some evidence-based services for family members. We know that we can impact behaviors by working with family members through evidence-based projects like community reinforcement and contingency management and other kinds of evidence-based practices if we engage family members, and also that we can increase the chances for someone to accept a treatment conversation if we're working with a family. So we're going to, one of our goals for the year is to work with one of our frequent partners, the Partnership to End Addiction, on developing some family treatment resources for providers and some training on community reinforcement in particular to help engage families into treatment. And we're also, working closely with Pat and Pat's team about what kinds of messaging might be helpful and making sure that people are aware. We're very aware. We talk to ourselves and we're very, very aware of the resources that are available. But the general public may be a lot less aware if they don't have the direct knowledge about where to go if they're having a problem. So both we've been working with Vibrant and the Hope Line, and with Pat, and we will have a new campaign person come on to our staff here at WASAS soon, and we'll continue our focus to try to make sure that everyone is aware of the services that you provide, and that everybody is aware of what are the risk signs and when to reach out for help. So Jim, it's a pleasure to be here. We do go way back, and it's always great to see, where you've taken the council as well and the leadership that you've shown in the field. So I appreciate it very much, and thank you.
Thank you, Pat. And I want to share one other thing is that, and I appreciate it and thank both of you for not only acknowledging our passion, but encouraging us to be passionate about this issue. You know, when we get passionate, it's not like, stop, Jim, stop, Jim. You encourage us to be passionate and to advocate for folks. And truly, I appreciate tremendously from both of you on that. You know, because there's been times that the passion of ours, the passion of mine has been not always accepted so much, but both of you do. And truthfully, it's rewarding, it's refreshing, and it allows not only me to be passionate, but for the staff to be passionate, and for everybody that we touch to be passionate about this issue. So thank you very much for that.
Okay.
And I will share this under both of your leaderships, to Pat's leadership, the state of New York
One of
is
my
in good hands.
Republican clients
So
are
thank you.
definitely thinking that the Democrat people are certain to see.
All right, our next speaker. In 2019, Robert Williams was reconfirmed as Executive Director of the New York State Gaming Commission, a position he has held from the commission's establishment until 2017, when he took a position as Deputy Secretary in the office of Governor Andrew M. Cuomo, where he held a portfolio limited to racing and gaming policy development and management. Previously to his first tenure with the commission, Mr. Williams served as a special assistant counsel in the office of Governor Andrew M. Cuomo, providing legal advice and counsel on Native American affairs and gaming-related matters. He has long experience having held a variety of policy positions in state government related to Native American affairs and gambling since the early 1990s. Just want to welcome Robert Williams and thank him for his years and years of dedicated services. Thanks, Rob.
Get this video up. Can everyone see the screen?
We see the team's screen right now.
I'm gonna stop share and see if we can get this up. Yeah, we can only.
Hold on just a moment, everybody. Okay, let's give this a try.
My name is Robert Williams, and I serve as the Executive Director of the New York State Gaming Commission. Thank you for the opportunity to address this conference. For those of you who aren't familiar with the Gaming Commission, we came into existence in February 2013 as a result of the merger between the Division of the Lottery and the Racing and Wagering Board. From our founding, the Commission has strived to be responsible in both our approach to gaming regulation and as a gaming provider as we operate the state lottery. Our former and current chairmen, Mark Guerin and Barry Sample, have focused on responsible gambling from the start. They have provided the leadership to ensure that we develop and implement a comprehensive statewide approach to responsible gaming. We identified three important components to our approach: provide education and increase consumer awareness, being responsible in our provision of gaming opportunities, and to do what we can to support services and resources. We have endeavored to integrate these components into our daily practices. One of the initial actions of the newly formed commission was to establish a better relationship between us, the regulator, or in the case of the lottery, the operator, and the two major statewide entities that support the address of problem gambling, the Office of Addiction Supports and Services and the New York Council on Problem Gambling. From these initial meetings arose the Responsible Play Partnership, a group developed to address a variety of issues surrounding problem gambling. For gaming venues, this includes undertaking proper outreach measures in addition to ensuring that they comply with all rules and regulations. For us, this includes an ongoing reevaluation of self-exclusion policies and further consideration of the best ways to advance New York's long-term commitment to prevent and treat problem gambling. As to Commission actions, when the commercial casino development arose, the Commission conducted a problem gambling forum to gather facts from experts, understand approaches, and consider best practices. Additionally, we worked to get a dedicated problem gambling funding stream included in the legislation that established a commercial gambling, to include responsible gaming elements in the commercial casino evaluation process, and then adopted a comprehensive regulatory package addressing responsible gaming plans for commercial casinos. The state doesn't readily publicize the problem gambling funding revenues driven by these legislative efforts. But since commencement of commercial gambling, a total of $14.8 million has been driven to problem gambling through both a device fee assessment and through collection of fines and penalties imposed on the facilities. Since we gathered last year, the Commission has remained committed to our addressing problem gambling. We have continued to incorporate responsible gaming into our daily operations across all divisions by developing a year-round plan to market responsible gaming in concert with our operations. We've sharpened focus on underage gambling and planned a rebranding of our identification materials with an 18+ ID required campaign to educate retailers and consumers about the law, which criminally prohibits the sale of lottery products for those under the age of 18. And we have maintained our commitment to Problem Gambling Awareness Month, Responsible Gaming Education Week, and Gambling Disorder Screening Day. I'd like to touch upon a few of these. As mentioned, the Commission has adopted a year-round responsible gaming marketing plan. This integrated plan recognizes the responsibility associated with buying and selling and marketing the state lottery as a age-restricted entertainment product. What does this mean? Between November and December, our lottery marketing staff will focus on gifting responsibility messaging with the goal of educating adults on the risks associated with youth gambling and a retail component that provides education engagement. In January and February, we will turn to responsible play and actively promote responsible gaming principles and increase focus on the availability of self-help tools and resources. In March, the Commission will join our colleagues around the country in highlighting Problem Gambling Awareness Month. In April and May, lottery marketing will focus on selling responsibly, pushing to retailers the talking points and incentives they need to undertake an active role in helping their customers make informed decisions about gifting lottery tickets. In July and August, we will increase our visibility at premier events around the state, including several county fairs and, of course, the New York State Fair. Finally, in September and October, the Commission will redouble efforts to promote age verification via a new 18+ campaign in conjunction with new staff training modules and a statewide public service announcement campaign. With respect to underage gambling, the Commission started an effort in 2020 that was derailed by the pandemic-related closing of over half of our retail network. As mentioned, we will commence a new 18+ ID required retailer-focused campaign to educate clerks, managers, and owners about New York Tax Law Section 1610, which prohibits the sale of lottery products to those under the age of 18. Our approach is multifaceted. We have some general comfort that the video lottery gaming facilities and commercial casinos are financially motivated to ensure underage patrons are kept from their respective facilities. So in large measure, we are presently aimed at educating the lottery retail community on the importance of age verification and are looking to develop best practices to deny youth access to lottery products. To achieve this, we continue to develop mandatory modules to educate each of our 15,000 lottery retail agents to focus awareness on their responsibility and ensure that each understands the important role that they play in interdiction. We expect to finalize this Sell Responsibly initiative in the first quarter of the next fiscal year. At the conclusion of our education period, we anticipate a compliance campaign in the nature of law enforcement's underage sale of alcoholic beverage compliance to ensure and reinforce the importance of taking age verification seriously. With respect to Problem Gambling Awareness Month, each year we embark on an effort to bring attention to the public health organizations, advocacy groups, and gambling operators who make available prevention, treatment, and recovery information and services. We annually produce a Problem Gambling Awareness Month public service campaign and place spots on television and radio stations from Albany to Watertown, from Long Island to Buffalo. Our division of the lottery launches a complimentary Problem Gambling Awareness Month campaign comprised of special messaging on all draw game tickets, customized electronic messages at retail locations, posters placed at 1,000 high-profile retailers statewide, and through social media posts on the lottery's Facebook, Instagram, and Twitter accounts. The Commission's Gaming Division and Horse Racing Division also participates through a Problem Gambling Awareness Month poster initiative, ensuring that each of our licensed facilities are raising awareness through high visibility placement. In 2020, we sought to conduct press conferences at each of the video lottery gaming facilities and commercial casinos within the state to draw attention to the important work and availability of problem gambling resource centers, promoting responsible gaming, and to get the New York State Hope Line number out there. Unfortunately, we were sidelined by the coronavirus, but are hopeful that in 2022, we can restart, complete the circuit, and help drive attention to Problem Gambling Awareness Month throughout the entire state. With regard to public service announcements, the Commission has continued its public advocacy of the issue of problem gambling via multiple public service announcements and various messaging throughout the state. We run a mix of problem gambling and responsible gambling public service announcements year-round, with topics ranging from getting people to break the habit of gifting lottery tickets to minors, to helping New Yorkers separate facts from the myths that surround all types of gaming, and everything in between. This past year, our cornerstone campaign was entitled Keep Your Game Grounded, which was intended to highlight the importance of gaming responsibly during Problem Gaming Awareness Month. The campaign also included television spots, radio spots, and a print campaign. I'd like to play the television spot right now.
Keep your game grounded. Gaming is fun when you remember to play responsibly. Only play with what you can afford. And if you really need the cash, keep it for what matters. To learn more about what it means to play responsibly, visit knowtheodds.org.
We are very appreciative of the 70 television stations and 106 radio stations statewide that run spots free of charge as a public service. And we also appreciate the lottery's media purchasing agency, Universal McCann, who places these spots pro bono. Development costs aside, the messaging alone has significant fair market value. The impression value of the 4 public service announcement campaigns we ran in the last year, Gift Responsibly, Fall Into Place, Keep Your Game Grounded, and Fact versus Myth, have an estimated value of $2.1 million. While small, these impressions reduce the need for expenditures by the New York Council on Problem Gambling, or OASIS, freeing funding for other worthy endeavors. Finally, we have a few new items in our world that might affect your world. First, you might have heard that the state legislature included a provision in last year's budget directing the Commission to undertake a competitive process to award licenses enabling the conduct of mobile sports wagering in state. This process is ongoing, but we expect all determinations and decisions to occur no later than mid-November. Obviously, we will be integrating the mobile sports wagering operations into the statewide voluntary self-exclusion program. And lastly, just this past week, pursuant to Chapter 59 of the laws of 2021, the Commission issued a request for information for the purpose of soliciting interest regarding the 3 unawarded casino gambling licenses authorized by the state constitution. The RFI can be accessed through our website in both the News and Resource tabs. The RFI seeks input from interested and effective parties who we have defined as prospective bidders for one of the unawarded licenses, or individuals or entities who potentially could be affected by the development of unawarded licenses. While the RFI has a few questions loosely grouped by topic, all parties are encouraged to provide any information they believe the state should consider in a future evaluation process. The deadline for submission of information is December 10th. In conclusion, the Commission recognizes the importance of addressing problem gambling and the work of the New York Council on Problem Gambling and its affiliates. I appreciate the Council for inviting me to speak today, and I thank you for your attention.
Thank you, Rob. That was great. And it's interesting being in the field for so long and seeing year after year more work being done by not only the Commission, but OASAS. It's heartwarming. As I listen to Pat, and Rob's presentation, I'm over here just smiling. I'm over here feeling great as a result of the work, the more work, the outstanding work that's being done by the 2 state agencies that are involved in this. So I want to thank you for that. And under the leadership of the 2 Pats and Rob, we're in good hands. So right now, we're going to conclude this. And at 11 o'clock, one of my favorite presenters of all time will be presenting. Dr. Lori Rugel will be on, and I look forward to seeing everybody at 11 o'clock. And once again, thank you very much for all that you do, each and every one of you that is on here today, because we need each and every one of your help to deal with this issue. It is a unique issue. It's different than anything else as a result of, you just heard Rob talk about new initiatives for expansion. We need each and other's support, help, advocacy, and passion. So thank you very much, and I look forward to the great work we're all going to do together. Thank you.
Thank you, Jim, for your leadership. You have really been great. Thank you.
Likewise, Pat.